everyone. My name is Luz Cantizano. I'm from Chile. I am a psychologist. I work at Fundación de Maipo, and I am implementation coordinator of Generation PMTO program in the family area of the foundation. Yeah. English is not my native language, so I will try to speak slowly for you. And please, if you have questions for me, I will appreciate a lot if you could try to do the same to understand you. So today, I bring you a presentation in which we want to share some of the part of the outcomes and the work that has been to implement an evidence-based program such as PMTO in Chile, going through different levels, context, implementation, and research, and how we combine the different elements that allow us to build bridges to implement a program like this. So first of all, I want to say thanks to all the people that are involved in the implementation and research process of the program here, sorry. And implementation, data analysis, research, it's a very big team, as you can see. So, well, to begin, I will show you briefly the agenda with the main topics. I will first talk about the context in Chile and the intersectoral model of the foundation. Second, I will try to share our experience in the importance of balance, the adaptations with fidelity. Then I will share some outcomes of research and our future directions. So, as you already know, I tell you a little more about the Chilean context. Well, about our organization is a 25-year-old institution, and our mission is to promote positive development of childhood from a preventive approach. The San Carlos de Maipo Foundation, it's a non-profit organization, and we work from different areas, schools, communities, families, research, among others. And in recent years, foundation has been installing a work where we could make the metaphor of a program incubator, because we look for evidence-based programs that solve important problems in our country. We implement pilots, make necessary cultural adaptations. We work to generate local evidence with the goal of reach a version of programs culturally relevant for Chile, maintaining the fidelity of the model, and looking for have feasible programs to disseminate on a larger scale with financing from government or another private institutions. Some of the programs that we brought to Chile have been interventions with strong scientific evidence, like Communities That Care, Familias Unidas, I Can Problem Solve, and Generation PMTO, of course. So, let me see when I can see here, my mouse. Well, in this sense, we are aware that the best way to achieve results is not to develop our own programs, because the most effective thing is understand that the wheel was already invented before and has evidence that it works. So our job is to see how could adjust the wheel to get in motion in the streets in Chile, that is with the communities and families in Chile. So, about childhood as a public health problem, we have the following background. The most common forms of violence that affect children occur in family settings. And the evidence also shows us that the parenting training interventions are the most effective to face this problem. And in this way, these interventions are an alternative that has proved evidence of its effectiveness in preventing child abuse and neglect, strengthen caregivers, parenting skills, benefit children's behavior and mental health, and are also a very effective alternative to reduce internalizing and externalizing behavior problems in children. But the problem is that the dissemination of this kind of programs in Chile, also on Latin America and Caribbean countries, are extremely limited. Yeah. So, well, specifically in Latin American countries, we have high rates of child abuse and neglect, which constitute a public health problem. It is estimated that in parenting practices, physical aggression reach 55% and psychological aggression reach 48%. And specifically in Chile, we have that 62% of parents report that they use violent discipline methods, and 73% of children report that their parents or relatives have been physical or psychological violent with them. And Chile is the sixth OCDE country with the highest prevalence of mental disorders in population under 20 years old. Although we have all these problems, but also we have exemplary examples of effort, progress, and achievement in Chile. For example, with the installation of Chile Crece Contigo, it's like Chile Grow Ups with You, which is a system installed at a national level with the goal to have an integral protection of childhood for all the children of the country. So, well, now I want to tell you a little more about this intersectoral model that the Foundation has developed in Chile to achieve, together with other institutions, rich programs that are culturally relevant and have scientific evidence. In this sense, the Foundation has the role to be a kind of articulating agent between different actors that could be involved in this process to bring, implement, and research EVPs in Chile. So, which are the different actors involved in this intersectoral model? In the first place, we have the evidence-based program itself. Secondly, we have agents that support the local research, including cultural adaptations. Thirdly, we have government institutions which have the capacity to implement and finance programs in a more larger scale. And fourth, we have private organizations which finance the initial investment to bring the programs to Chile. Then we have also the schools and the families that as the people that receive and allows us to implement the intervention. So the goal of this model is gradually combine these traits, valuing the expertise of each different agent to put all their experience at the service of the common goal. Yeah, because it often happens that the different traits or actors are working on separate paths, trying to achieve the same goal. Yeah, but this is not efficient. Instead, if we work together and weigh these traits to generate a larger bribe or weight as a product, we are more likely to come to closer to achieve the goal and achieve more consistent results together. Yeah. So the result of this waving being two words simultaneously is that we have evidence-based programs that allows us to preserve the quality impact that we want to produce in the families. Research allows to generate local evidence of these programs. Government institutions contribute to develop effective public policies. Private agencies promote fast and efficient process for develop cost-effective and ethical public policies. And schools and territorial organizations, of course, allows us to reach the communities, and the families interested in participating allows us to implement intervention and develop local evidence. So this general model, in this particular case, we can see that the program is Generation PMTO. Yes, the institutions that support in research process are University of Andes in Chile, University of Texas at Austin, and the Oregon Social Learning Center. And we also have the National Service for Prevention and Rehabilitation of Drugs and Alcohol Consumption. It's SENDA, like NIDA here, yeah, as a government institution, the foundation as a private agency, the schools and the families. And the product of this is that we have a version of Generation PMTO tailored and adjusted for the Chilean reality, yeah, culturally relevant for the families of our country, and that in Chile today we know as parentalidad que motiva con ternura y optimismo. That is like parenting that motivates with tenderness and optimism. Yeah. So having explained the intersectoral model of collaboration, something that is important to highlight is the cultural adaptation process of the intervention. So that consists of two major components: the adaptation of the intervention itself and the adjustment to ensure fidelity of implementation to the model. For the sake of the time, I will just briefly explain the adaptation process, which started with an initial translation and validation of the manuals and materials intervention. We conducted a thorough process of adaptation according to the 8 dimensions of ecological validity model that includes, for example, language, methodology, metaphors, among others. That process was followed by focus group and interviews with families to ensure that the adaptation were relevant to the Chilean context and culture. And also, we complement those with interviews and focus groups with the interventionists to also receive their perspective of this process of adaptation. And all that information was also reviewed by adaptation experts who included the first adapters of Generation PMTO for Latino immigrants in US, but also for Mexican cities. And in addition to those contextual and cultural adaptations, because of COVID, yeah, we conduct an extensive adaptations to adapt to a virtual environment. And all these jobs have been carried out in a very collaborative work with feedback and validation from the creators of the program to maintain the fidelity. In this sense, of course, in any of the adaptation process, it's essential to pay attention to fidelity of the implementation rating system. So we follow very strictly to all the protocols established by Generation PMTO to ensure adequate implementation to the core components of the intervention. So I would like to say that, as it happened to everyone, we never expected that we would deliver this intervention in virtual modality, and we had to adapt very quickly, because of COVID. So we have some learnings of this process here. The first things at the beginning of the pandemic was to gather information from the families to see if they would be willing to participate in a virtual intervention. We found that yes, the families even more told us that they needed more because they are with child all the time in the houses in periods with a strict quarantine. Another important thing was that the implementation team received training for specialists on virtual platforms in order to manage the tools well to do the intervention then with the families, yeah? And we also searched information to find out which was the best alternative platform available on the market to implement the sessions, and we reached the conclusion that it was Zoom. Although we couldn't provide electronic device to the families, we could provide internet to those families that need it, and with the data mobile can connect for the sessions. So we also send the parent materials to their homes for families, so that they could have it print and work with it during the sessions. And we also created short tutorial videos for download Zoom and enter for the session from a cell phone or computer, and the families could solve before the first session. So, and the last point that we detected, it was the need to create a new role for the team, at least in the first sessions. It was a person in charge to solving technological issues during the session with the families. So the practitioners could continue leading the session, and if a family requires support, they could have it. Yeah? So, now I will move on to the topic associated with the particular research that I told you, and share some outcomes. About the context of the research, we implement a pilot of the program with 407 families, of which 351 were invited to participate in the research. Yeah? So the pilot was financed by Senda throughout a public tender that foundation was awarded. And thanks to the previous work, the foundation has the ability to implement the program with this number of families between August to December of 2020. Yeah? So the team was composed as follows. The training initiated in a very small scale, intense according to the original training. It was with 3 ISII trainers that trained 5 foundation interventionists, and these people progressed on their certification levels, and they were responsible for train and coach 20 interventionists from SEND. So we did an exploratory study, without control condition, with a quasi-experimental purpose design, and the data collection was virtual. Related to the sample, for the research, the initial recruitment was composed for 315 families, and after accounting the attrition and families who didn't complete the assessment after intervention, the sample for the final analysis resulting in 281 families from 20 schools. About the instruments that we use, we look for a validated and consistent scales to measure the core components of the program. We took the same survey twice, before and after intervention, and because the survey was taken virtually, we considered to have a telephone assistant. So, this is a summary of the intervention outcomes. Just to remind you, it's preliminary study. This is not an RCT, but this was a purpose design that allows to find some outcomes. And as you can see on the table, we were able to observe significant results in the different subscales that we measured, and we expect positive results, but according to the literature, we expect change between small to medium change, but we were very surprised to also find many outcomes with large effect size. Yeah, for example, we found large effect size in in heart discipline, family problem solving, and family adaptability, internalizing problem behaviors, and also slightly biggest than the other one, externalizing problem behaviors. Yeah. So some of the results of the satisfaction survey were that 95% of families say that they always or almost always use the tools that they learn on the program. 98% of the families say that they will absolutely recommend the PMTO to other families, and 100% of the schools say that they were interested in having Generation PMTO in their school again. And to finish, I would like to share a little about our future directions with Generation PMTO in Chile. So we have the project to develop an RCT of the program in Chile. Another goal is to continue working to disseminate the program on a larger scale. Also favor the feasibility of a large-scale implementation, working to find a cost-effective model that allows the program to be replicated. And we were also starting to work on an R01 application. Yeah, so this is all. Here some reference, and thank you very much for your attention, your interest. If you have any questions,